Nearly 6 out of 10 cancer cases arise in adults aged 65 and older. The American Cancer Society reports that older adults face the greatest risk, not only of developing cancer, but also overlooking the earliest clues because they can look like ordinary aging or mild everyday problems. Here is the frightening reality: when symptoms finally become obvious, the disease is frequently advanced. Data from the National Cancer Institute show that survival for cancers detected early often exceeds 80%, while diagnoses made at later stages can see that number fall to 20% or even lower, depending on the cancer. The difference is dramatic. For a simple reason, early disease tends to be confined and highly treatable. Once it spreads, treatment choices narrow quickly. Early detection can truly spell the difference between full recovery and a life-threatening illness. That is why this video spotlights 8 early cancer warnings adults over 60 must not dismiss. These are not the classic red flags everyone recognizes. They are quiet, deceptive signals that slip past attention until damage is already done. We will count down from number 8 to number 1, saving the most dangerous and most frequently missed sign for last. Stay with us through the conclusion, because we will also share 3 science-supported foods that can meaningfully lower your cancer risk. Before we dive in, tell us in the comments where you are watching from. Remember to like this video and subscribe to our channel for more content. Like this, let's begin. Number 1, off or general unwellness. This is the most elusive sign, and the one that matters most. In the earliest phases, many older adults do not experience dramatic symptoms. Instead, they report a hard-to-name sense that something isn't right. It's vague, difficult to describe, and even harder to diagnose, which is why it slips past attention. You might notice deeper fatigue than usual, a mental haze, or that ordinary tasks demand more effort. Some people feel strangely uneasy or off balance, despite everything seeming normal on the surface. These sensations can reflect the body's response to chemical messengers released by cancer cells that nudge immune and nervous system functions out of rhythm. Others report low-level lingering issues such as a mild sore throat that never fully resolves, unexplained chills, or intermittent low-grade fevers. What separates this from everyday fluctuations is the pattern over time. If this vague unwell feeling persists for weeks, treat it as a signal rather than an afterthought. Clinicians may suggest broad laboratory panels and imaging to look for hidden causes. Often the result is benign, but many early diagnoses begin with a person who trusted their instincts. You know your body better than anyone. If it keeps sending a quiet message that something is off, pay attention and get it checked. Number 2, changes in your nails or fingertips. Nails may seem like an unlikely place to spot cancer clues, yet subtle shifts there can speak volumes. One of the most telling patterns is clubbing, where the fingertip ends round out and nails curve downward. This can be an early indicator of lung cancer and, at times, gastrointestinal cancers. The mechanism often involves chronically reduced oxygen in the blood, prompting alterations in the nail bed and surrounding soft tissue. You might notice nails that feel springy or spongy, look unusually shiny, or are tender when pressed. Another warning to take seriously is the sudden appearance of dark vertical streaks within a nail, a possible sign of subungual melanoma, a rare skin cancer originating under the nail. Nails may also grow brittle or develop tiny pits and grooves that were never there before. Older adults often chalk these findings up to aging or nutrient gaps, but rapid onset changes or alterations confined to a single finger deserve prompt attention. Because nails rarely get scrutinized unless they split or break, these signals are easy to overlook. When new nail abnormalities persist without an obvious cause, clinicians may order blood work or chest imaging to search for internal conditions. Small details can carry big implications. Treat unexpected nail changes as a message worth investigating. Number 3, bone pain that has no clear cause. A sore back today or a stiff shoulder tomorrow can feel like standard aging, but persistent unexplained pain that lingers or intensifies deserves closer attention. Cancer-related pain is deceptive because it may not originate where the cancer is located. A tumor in the pancreas can manifest as constant back pain. prostate cancer may present as aching in the hips or thighs. Deep bone pain or pronounced joint aches can also indicate bone metastasis, meaning cancer has spread. The hallmark features are persistence and a gradual rise in intensity. This discomfort often resists common painkillers, tends to be worse at night, and ramps up over time. Many older adults describe a deep gnawing sensation that feels different from typical arthritis. Others report sharp pain even at rest or discomfort that seems to migrate. These patterns occur because malignant growths can compress nerves, invade bone, or inflame surrounding tissues from within. If you have been nursing the same painful area for weeks without relief from rest, gentle movement or over-the-counter remedies treat it as a warning sign. Clinicians may begin with X-rays or MRI scans to look for structural problems, but more sensitive studies such as bone scans or PET scans are often necessary to uncover cancers that remain hidden on standard imaging. Do not accept worsening atypical pain as your new normal. If it feels different from the aches, you know it is time to get evaluated. Number 4. Unexplained night sweats. Waking to soaked pajamas in a cool room with light bedding is more than a nuisance. It can signal trouble. Although many people attribute nighttime sweating to menopause, vivid dreams, warm weather, or stress, persistent drenching episodes can be an early clue to certain cancers, particularly lymphoma or leukemia. The pattern is telling these sweats are intense, recur night after night, and often appear without fever or any sign of infection. You might even need to change clothes or sheets before morning. The underlying driver is inflammatory chemicals released by cancer cells that interfere with the body's temperature control during rest. Sometimes night sweats arrive alongside a low-grade fever, unexplained tiredness, or modest weight loss, but they can also occur in isolation. The danger lies in how easily they are dismissed as hormonal shifts, medication, side effects, or lifestyle factors. If you are not acutely ill, have not altered your routine, and still experience heavy night sweats for more than a week or two, it's time to speak with your doctor. Simple blood work or imaging may be advised to search for deeper causes. Fans and thinner blankets won't resolve cancer-related sweating. Consider it your body's urgent signal that something significant may be changing inside. Number 5. Skin that suddenly looks or feels different. Getting older naturally brings drier, thinner skin that bruises more easily, but cancer can also announce itself through skin changes that seem harmless at first. If a patch becomes unusually rough, discolored, or irritated without a clear trigger, it may be more than ordinary aging. Early skin cancers and even internal malignancies that disrupt the immune system can show up on the surface. Some people develop an itch in one spot that never settles, despite creams or medications. Others notice areas that turn red and inflamed, mimicking eczema, or a yellowish cast to the skin that can signal liver trouble. A distinctive clue to watch for is acanthosis nigricans, where folds of skin, commonly the neck or armpits, grow thicker, darker, and velvety. This pattern can sometimes point toward gastric cancer or insulin resistance. You might also observe slow healing cuts or bruises that appear with no remembered bump signs that can accompany blood cancers such as leukemia. The strategy is simple. Pay attention to changes that are new, persistent, and especially those on skin not routinely exposed to sunlight. If your skin starts behaving differently and does not improve over time, your clinician may recommend a closer look with a biopsy or order blood work to rule out a serious cause. Number 6. Strange or new stool. Changes, it's not a favorite topic, but your bowel movements can reveal a great deal about what's happening inside your body, including early cancer warnings. While brief episodes of constipation, diarrhea, or unusual-looking stools often tie back to food choices or hydration changes that persist for several weeks deserve attention. Ongoing shifts in pattern or appearance can signal colorectal, pancreatic, or liver cancer. Color is one of the most important clues. Stools that look pale or clay-colored may reflect blocked bile flow, sometimes caused by a tumor in the pancreas or liver. Very dark or tarry stools can indicate bleeding higher up in the digestive tract. Shape matters too. If stools are repeatedly thin and ribbon-like, a mass pressing on the colon could be limiting normal passage. These signs are easy to dismiss as simple gut issues, but when bathroom habits change dramatically and don't return to baseline, it's time to look deeper. You might also notice more bloating than usual, a sudden urgent need to go with little or nothing, passing, or a lingering feeling that you haven't fully emptied. Such symptoms suggest something is interfering with the usual movement of the digestive system. Your stool is often one of the first mirrors of internal trouble. Don't ignore what it's telling you. Number 7. Eye pain or changes in vision. It's easy to dismiss eye discomfort as minor yet persistent pain, or sudden shifts in how you see, especially in adults over 60, can signal something far more serious than routine strain. Ongoing eye ache blurriness that doesn't clear, or floaters that linger, may indicate a rare early warning of cancer, including ocular melanoma or cancers that have migrated to the eye from other sites such as the breast or lung. Eye-related malignancies can involve the retina, the optic nerve, or the tissues around the eye, and they often start quietly. You might notice intermittent flashes of light, subtle distortions in shapes, or blurring in one eye, while the other remains crisp. Some people describe a dull, unrelenting pressure behind the eye that feels like sinus congestion, but never fully resolves. Unlike ordinary age-related vision, these symptoms persist or steadily worsen, and are sometimes missed during routine exams. If cancer has spread to the eye, problems like double vision or increasing difficulty seeing at night can develop. To look beneath the surface, an ophthalmologist may order specialized imaging, such as ocular ultrasound or a detailed retinal scan. Delaying evaluation risks permanent damage, and if the disease advances, consequences that threaten life. Do not write it off as normal aging when your eyes raise an alarm act on it. Number 8. Persistent heartburn. Occasional burn after a heavy or spicy meal is common. But for adults over 60, heartburn that keeps returning or lingers, especially if it disrupts sleep or makes eating difficult, can signal more than simple stomach upset. Ongoing acid reflux may point toward early trouble in the esophagus or stomach. Many older adults chalk it up to indigestion or aging, yet repeated acid exposure can inflame the esophagus, leading to Barrett's esophagus, a condition that markedly increases long-term cancer risk. What begins as a faint burn behind the breastbone or a sour taste can over weeks or months grow more frequent and tougher to control. You might notice food hesitating or sticking, while you swallow a raspy voice on waking or a reliance on daily antacids just to get through the day. When cancer is part of the picture, the lining of the esophagus or stomach starts changing at the cellular level, and irritation persists regardless of careful eating. Doctors often investigate with an endoscopy, passing a small camera through the throat to look for abnormal changes. If heartburn has persisted for more than a month without improvement, despite dietary adjustments or medication, treat it as a warning from your digestive tract and seek evaluation. Now, for the empowering Part 3 everyday foods that can help lower your cancer risk. Science is clear that no single item on your plate can guarantee prevention. Yet consistent research shows that certain foods, when woven into a balanced diet, can meaningfully tilt the odds in your favor. Number 1. Broccoli. This modest green vegetable ranks among the most extensively researched cancer-protective foods. Its standout compound sulforaphane helps dampen inflammation and shield cells from DNA damage, a key step in cancer development. In a landmark investigation from the National Cancer Institute that tracked 50,000 men for more than a decade, those who ate just one daily serving of cruciferous vegetables had a 32% lower risk of aggressive prostate cancer than those who rarely ate them. Mechanistically, broccoli supports the liver's detox enzymes and interferes with cellular pathways cancer cells rely on to multiply. Preparation matters. Light cooking preserves more goodness than aggressive boiling. Steaming for about 3 minutes is a smart approach. Aim to work broccoli into dinners several times a week to give your body a consistent advantage. Number 2, tomatoes. Tomatoes offer more than pasta-friendly flavor. They are rich in lycopene, the red pigment linked to reduced risks of certain cancers, notably prostate and lung. A large study in the Journal of the National Cancer Institute found that men consuming tomato products more than 10 times per week had a 35% lower risk of developing prostate cancer compared with those who rarely did. Lycopene acts as a potent antioxidant, helping guard cells against oxidative stress that can spark malignant change. Heat actually boosts lycopene's bioavailability, so cooked options like homemade sauces or roasted cherry tomatoes can be especially effective. Choose minimally processed versions and steer clear of products overloaded with sugar or additives. Number 3, berries. Blueberries and raspberries may be small, but their protective potential is sizable. They supply anthocyanins, ellagic acid, and vitamin C compounds that neutralize free radicals and calm inflammation throughout the body. In research published in the Journal of Agricultural and Food Chemistry, rats fed a berry-rich diet saw a 58% reduction in esophageal tumors compared with those on a standard diet. While that is an animal model, human studies also show regular berry eaters tend to have lower markers of oxidative stress and inflammation. Their fiber nourishes beneficial gut bacteria, supporting immune regulation, which is your front line against abnormal cell growth. Blend berries into smoothies, scatter them over oatmeal, or enjoy them plain as a snack. They are a tasty, practical addition to a cancer-conscious routine. Early action saves lives, and small daily choices compound into powerful protection. Pay attention to your body's whispers before they become shouts, and keep your plate working for you with real whole foods like broccoli, tomatoes, and berries. If today's countdown helped you spot a warning sign or gave you a practical step you can use at your next meal, tell us in the comments. We read every single one, and your story could help someone else take action too. If you want more clear science-backed guidance like this, hit subscribe and tap the bell so you never miss a new episode. Like this video, share it with a friend or family member who needs it, and drop your city below so we know where you're watching from. Your health journey is personal, but you're not walking it alone. Stay curious, stay consistent, and we'll see you in the next video.